Hi everyone. I just wanted to give a really quick update on health and also on the way that I have been dealing with health mentally and emotionally, I guess. So, another reason why I haven't been doing a lot of videos lately is because I've been in kind of a negative place, and I really don't want to share my negativity only on the days where I feel positive, which are most days, but not all, of course. Everyone has their bad days. So, as you all who watch my videos know, I have my drain because I have an inclusion cyst in my lower abdominal area. So, that's been draining semi-nicely up until about a week and a half ago where my drain stopped working. Now it seems to be working a little bit, but not as well as it probably should be. So, that kind of stinks, but that's not what stinks the most, of course, because we always have things that really stink more than things that are already bad. So, my surgeon and I talked about what we're going to do about this inclusion cyst. So it's in between my lining of my stomach and my stomach, or not stomach, I'm sorry, like abdominal cavity. I shouldn't use stomach, that's a totally different organ. So abdominal wall, abdominal um, like lining, and the fluid has like created this pocket in between the two and they're supposed to be always together. And the problem about these pockets of fluid, unlike my abscess which healed up very nicely, this has a really hard time fusing back together. And that's really scary because all of the fluid could be gone from this drain after this really long, like 2.5 months that I'm going to have it in. And usually when a drain comes out, you're really happy, but unfortunately, I'm going to have to wait to see if it comes back. And if it does come back, which he says is not uncommon at all, I will have to get the drain reinserted, probably be completely awake for that procedure too, because it seems like every drain insertion I've just been awake for. And then it has to stay in until all of the fluid comes out again, and then he will put a medicine, oh my gosh, why can I not think right now? Antibiotic, wow. An antibiotic up my drain and into that cavity once all the fluid's gone, and this kind of encourages the two walls to kind of fuse together. One of the problems with this procedure is that it makes women more likely to be infertile, which already, if you have your J pouch, it kind of increases the risk of infertility as well. So not only did my surgeon tell me that this was super painful and that I would have to stop school for a while to be admitted into the hospital so he could give me pain medications and do this procedure, but also it affects the rest of my life possibly. And that is something I've always dealt with, and so have you all, because we have something chronic. Of course it's going to affect the rest of our lives, but this really threw me for a loop, I think, just because I was supposed to have my surgery 7 months ago to reconnect me, and then that was supposed to be it. But I've had 7 months worth of bad things happen that have been challenges. And I was talking to Andrew, who I had on another video, my boyfriend, and he's my safe place, so I talked to him about a lot of things, and I was saying to him, how many obstacles does it take for a strong person to become weak? How many times does something really difficult have to happen? How long? How long does it take? Does it take 3 years, the amount of time that I've had so far? Does it take 5 years? Does it take a lifetime? And then I said to him, my disease is chronic, so my disease has a lifetime to completely break me. And that really sucked, kind of thinking about it like that. And then I went over to see my psychologist. I have a psychologist to deal with just the idea of chronic pain and having something chronic at such a young age, being diagnosed at 18, which a lot of people are diagnosed at 18 or even younger with this. So we were talking about that, and I was telling her the story, and then she kind of said something that triggered a thought in like both of our minds, and it was weird because we kind of had the same thought. And if you are a bodybuilder, or if you just work out, or if you are a doctor or anything, or if you just know this general knowledge, we thought about struggles with chronic illness as muscles. So when you work out, you actually rip your muscles because they're going through some sort of trauma, and ripping your muscles enables them to grow back stronger and bigger and better than they were before. And so we both kind of made this parallel between going through really difficult obstacles and having so many setbacks with a chronic illness to ripping a muscle. Yeah, it hurts and it's going to take some time to heal, but when you heal, you're going to be much stronger because you did rip that muscle, because you did go through that chronic, painful thing. And so, you can think of things, a lot of having a chronic illness and thinking about having a chronic illness, it's really a lot of choices on how you want to approach life and how you want to live your life afterwards. And after, the diagnosis and like just getting used to everything. And I think a lot of the decisions we make are, do we view something as terrible, horrible, and I'm never going to get over it? Or do I view it as something that, yeah, it sucks, it's terrible, it's painful, but I'm going to thrive from this? And so I think that that's a really good analogy for people who have been facing things like I am too that really suck and just totally throw off your life plans all the time. I've had to reschedule so many things in my life because of this, but we are just like one giant muscle that is ripping all the time and just growing back bigger and stronger and better. And we also get a lot of wisdom on the way. So that's my little like preachy moment. I hope that this was at least a little bit helpful or food for thought, especially if you're going through a lot of setbacks, because, healing is a very, very long and difficult process, but it is worth it, and I hope you all are just feeling well. I hope this wasn't relevant to any of your lives, but I'm sure it was. So, I guess that's all I have for you. I will talk to you guys soon. Bye.